Hi, this is Habib Samadi from the Georgia Heart Institute, and I'm here today with two phenomenal clinicians, Dr. Ugo Egelum, who's the head of our Heart Failure Treatment and Recovery Center, and also Dr. Nidia Stelikar, who's one of our superb heart failure cardiologists. We're here to talk to you about the Heart Failure Treatment and Recovery Center, although I will ask Dr. Egelum whether he likes that name or whether he's going to iterate it over time. But Ugo, tell us a little bit about our center. Tell us a little bit about what heart failure treatment and recovery is. I mean, the name sounds kind of scary. And then tell us about what you're doing within the Georgia Heart Institute to grow our program.
Excellent. First of all, thanks, Habib, for having me on the show today to talk about a lot of the exciting things we're doing at Heart Center. The issue we're having is that heart failure is a pandemic. I mean, we've been using that term to talk about COVID-19, but heart failure is really on that level because there's so many patients that have it. And what we're doing at the Heart Failure and Treatment Recovery Center is that we're bringing together all our best resources to see patients that have heart failure and provide them the best care possible. So as in the name states, we want them to have treatment and recover and go back to their prior function. So that's really ultimately what it boils down to.
Got you. So Nidia, what is heart failure and what sort of patients present with heart failure and what sort of symptoms do they have?
Mm-hmm. So heart failure, and I thank you again for having me on this show as well, but what I want to clarify for everybody is that heart failure, the term is so scary, and I always want to tell patients that it's just the term, but what we are trying to help you through is how to manage your lifestyle, how to treat you, how to get you feeling better. I mean, that's really the goal. So the symptoms they might present with would be shortness of breath, just not being able to do things, swelling in the legs, swelling in the belly, different kinds of manifestations. And it's not really one thing, and we want to have, this out so we can have early recognition so we can really help them through their whole spectrum of disease.
Yeah. So, I'm a patient, I'm 68 years old, 70 years old, and I have shortness of breath. Mm-hmm. And let's say I have some swelling in my ankles. Mm-hmm. Do I have heart failure? How do you figure that out? And are those the sorts of patients that should be coming to the center?
Yeah, definitely. There's, as mentioned by Nithya, there's a number of symptoms that patients with heart failure can have. But also, there's a lot of things that can look like heart failure.
That's right.
So I think this is why it's important to really have the expertise that we have at the Heart Center to be able to evaluate patients. Certainly, we always begin with taking a good, detailed history, talking to the patient. And then next to that, if we need specific testing, and that's when we obtain that. Oftentimes, it's an echocardiogram that we begin with. Mm-hmm. In short, it's an ultrasound of the heart to let us know how well the heart's working or not working. Mm-hmm. And there's some laboratory tests that we do as well that will help us diagnose the patient.
Okay. So, Nidia, you've diagnosed the patient, mm-hmm. and admittedly, sometimes patients will present to you, and as Dr. Egelum said, they may not have heart failure. Mm-hmm. They may have lung conditions, mm-hmm. or they may have, coronary mm-hmm. disease or other conditions. Mm-hmm. But let's say you've diagnosed them with heart failure, mm-hmm. and essentially what that means is for some reason or the other, mm-hmm. the pressure in the heart is high enough that mm-hmm. the fluid lags behind in the lungs. Correct, and causes shortness of breath. Correct. That is essentially heart failure, right? Correct. So let's say you've diagnosed heart failure. Mm-hmm. How do you start thinking about parsing out the different causes? I know Ugo mm-hmm. mentioned an echo to start mm-hmm. with. Correct. What are some of the things patients should think about with respect to heart muscle function, and how do you start thinking about that?
It's a good question. So, again, the echocardiogram is the cornerstone. We start with that. That tells us, is the heart function low? Is it that type of a heart problem, or is it a heart function that's preserved but stiff with age? And oftentimes, it kind of goes down two different pathways, trying to figure those things out. Other causes that we would look for is either blockages in the arteries that's causing that. Is there a genetic cause for this? And we do genetic testing at our office as well. Is there other causes for all of this, such as hypertension, sometimes drug abuse, sometimes other medications that can cause this? So oftentimes just going down that pathway and explaining it to them at each stage is so important so that they form a part of this and they understand why we're doing all of this.
Wonderful. So Ugo, we're, as a patient, now we're starting to understand the different conditions that function. You've got, when your heart function is preserved or normal, when your heart function is weak, and sometimes when you think it's normal, it's stiff.
Right.
But I think what Dr. Selekar also mentioned is that there are a number of other conditions. Can you talk to us a little bit about how your team interfaces with other cardiologists? So what happens if you have heart failure and your valves are leaking, or
Right.
you have heart failures and the electricity or the conduction system is not working? How do you interface with that, and how do you keep your care patient-centric?
Correct. Yeah, I think, Habib, you hit the nail on the head with that. What we're clearly demonstrating is that heart failure is a very complex disease.
Yeah.
There's multiple things that are involved. And again, that heart team approach that we've championed here at the Georgia Heart Institute is really what we stand on and help us manage these patients. So for example, if a patient has a lot of leakage of one of their valves, let's say, for example, what we call the mitral valve, there's interventions we can take to help improve that, along with medical therapy. The backbone is always treating them with medications of heart failure. So we do have our interventional cardiologists who are part of our valvular disease clinic, so we may refer the patients to be seen by them, and they will look at a patient, evaluate, and decide if the valve needs to be intervened on. But again, we go back to other things that are more common, perhaps coronary artery disease. If there's significant blockage, some of these patients may need a stent put in which case our interventional cardiologist is capable of doing that. Some patients, if they have a lot of blockages and they need surgery, our cardiac surgeons are part of our heart failure treatment and recovery center, and we rely on their skills to be able to fix that. So again, the patient is fully evaluated, and we use that team approach to really figure out what the patient needs to get them better and recover.
Wonderful. So, okay, so now it sounds like you have a whole gamut of options.
Right.
You have these different,
Yeah.
tools in your toolbox,
Correct.
and you are kind of the brains behind this and the quarterback, and saying, okay,
Right.
you've got a really weak heart muscle, or you've got a stiff heart muscle.
Right.
Let's try to parse out what's causing this, and then let's try to fix that individual problem.
Right.
So tell me, Nydia, a little bit about, let's say your heart muscle is really weak, and you've tried all the things Ugo's talked about. You've fixed the valves, and you've maybe put in a device to help with the conduction system and unblock some arteries. But despite all that, maybe it's far along.
Right.
You're 57 years old, the heart muscle is extremely weak, and you're struggling.
Correct.
So what are options for those patients,
Yeah.
and what does the Georgia Heart Institute have to offer?
It's a great question. So, we are one of the very few centers in this area which can provide advanced heart therapies, which runs the gamut from sometimes it's just IV medication like milrinone to actually support. We also are able to provide, to the extent beyond that, is what we call LVADs, or left ventricular assist devices. And what that is it's a machine that basically tries to function for the heart. And, we guide the patient to find out which patient is appropriate to get this therapy, but also ones who, want to survive, want to do everything. We want to help them through this. So we are definitely capable of that. Our surgeons are fantastic at placing those. And we have a great team, including a great LVAD coordinators, nurses, everybody who will educate them through all of this, as well as guide them, the families and everybody else, through all of this.
Wonderful.
So we definitely have that.
So Ugo, under your leadership, the program has really soared. You recently have had, accolades, and you've had certification. Tell us a little bit about where your vision is for the Georgia Heart Institute Heart Failure Center, where we are today, and where do we want to be in 5 years so that we can provide care not just for the region, but also beyond.
Correct. Yeah, so as part of the Heart Failure Treatment and Recovery Center, really our vision is to be not only a local recognized center for heart failure treatment, but also nationally and internationally. So what we're really doing is gradually we're growing our team. We've recently added another heart failure cardiologist. Dr. Acosta came to us from the Texas Heart Institute, and it's been a wonderful addition to our team. Other things we're doing is we're really focused on growing our research portfolio. I think research is really an important way to have our patients be exposed to some of the cutting-edge therapy and technologies before they're fully available and they get access to it early. So we're working with a number of folks in industry and bringing a lot of really phenomenal research opportunities that are happening here. But not only are we doing that, we're also publishing. So a lot of the things that we're doing, we notice that they're making a difference. We publish it, we present it in journals, and other people elsewhere in the world can read it and be able to do the things that we're doing. Additionally, we attend national meetings where we present our work and interact with folks from other places. So there's an ongoing exchange of ideas that continues to go on as we move forward.
Wonderful. And I think what's really phenomenal is that all this wonderful work with Dr. Egelem, Dr. Stelakar, you mentioned Dr. Acosta, and Dr. Rajay, Vikram Rajay, who's
Correct.
another superb cardiologist on the team, is also an interventional cardiologist. This is all fundamentally a patient-centric approach,
Yes.
right? The patient experience is always at the heart of everything you all strive to do. And when I see your teams,
Correct.
including your nurses, your medical assistants, your LVAD coordinators, your other coordinators, and actually Amy Cutshaw, who's our program director for this, it's really a holistic approach to taking care of our patients and really providing the best care for these patients that often are quite sick. So I want to thank you both for joining us.
Thank you for having
And
us.
until next time, thank you very much from the Georgia Heart Institute.